guys, and welcome to another episode of MedVize TV, where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, acid reflux. Today we're going to talk about the best ways to deal with heartburn, formerly known as acid reflux, more formally known as gastroesophageal reflux disease, or for short, GERD. Well, what is it? It's just a backflow of acid in your stomach back up the esophagus. Sometimes the reflux is only in the lower part of your esophagus, but sometimes it can get so bad it can come all the way up into the throat and into the mouth. Physicians usually diagnose acid reflux with the symptoms you describe to them and the frequency that it occurs. Now, if you're having acid reflux, it's very important to have that treated, as acid reflux can actually develop into a lot of other health complications that we'd want to avoid. So, how do you treat it? Well, we all know the saying, the best form of treatment is prevention, and there's nothing new here. Prevention and lifestyle changes are imperative to best managing acid reflux. The following are tips and tricks on how to best prevent acid reflux. Most important thing, avoid triggers. Certain foods and drinks can cause acid reflux, but everyone is different and everyone might have a different trigger. For some people it could be chocolate. I know, it's terrible news, but it gets worse. Caffeine can also be a trigger. That's right, coffee. Don't take my coffee away from me. Alright, that's enough of that. Triggers can also be spicy or acidic foods and carbonated beverages. Weight loss has actually been shown to be one of the best lifestyle changes that someone can make in preventing acid reflux. Another big thing is to quit smoking. Smoking cessation is very important in helping prevent acid reflux. Avoid eating about 2 to 3 hours before bedtime, especially high fatty foods. Also, avoid laying down after meals. Bed elevation has also shown to improve symptoms of acid reflux, especially at night. I'm not talking about just your head, because then you'll just be sleeping like this. No, you need to actually figure out a way to get your bed at a certain angle. I cannot help you with how to figure that out though. I'm a pharmacist, not an architect. And last but not least, you could actually be taking a medication that causes acid reflux. So speak with a pharmacist to see if one of the medications you're on could be causing your acid reflux. When might you need to see your primary care provider? If your symptoms last for more than 2 weeks while using over-the-counter medications, you should definitely consider seeing your primary care provider. If you have pain or difficulty swallowing, if you're vomiting up blood, if you have black tarry stools, or if you have frequent nausea and vomiting. So prevention didn't work. How do we treat it? Well, it depends. Let's talk about over-the-counter medications. My first recommendation is usually to use antacids, especially if you're only using it as needed and your symptoms are fairly infrequent, like less than 2 or 3 times a week. Tums and other antacids are really good for immediate relief. They work within minutes. But please be careful. There are some antacids out there that do contain aspirin. Anything that contains aspirin or any other non-steroidal anti-inflammatory, or NSAIDs for short, anything that contains an NSAID should be avoided, as it can cause a bleed in your stomach if you're dealing with acid reflux. The original Alka-Seltzer is known to have aspirin in it, so please make sure to avoid that. Please make sure to read the back of your bottles to look at the active ingredients, and if it says aspirin on there, please make sure to avoid that. So what are some downfalls of antacids? Some of them don't taste really well. Tums really doesn't taste good. I don't know if you ever had one. That taste is not fun. They can cause bloating, can cause gas. Depending on which antacid you use, it can cause constipation or it can cause loose stools. So the antacid magnesium is what causes the loose stools, and the antacid aluminum is what causes constipation. One of the other drawbacks of an antacid is it only lasts about 30 minutes to an hour, but you get immediate relief. Another drawback of antacids is they bind really well to other medications. Depending on the medication you're taking, if you want to take an antacid, you may have to take the antacid either 2 to 4 hours before taking your medication, or 2 to 6 hours after that medication, depending on which medication it is. Somewhere on here I'm going to include a list of antacids. Maybe here. The next class of medication I want to talk about is called the H2 blocker. We'll call them H2s for short. It's real complicated what H2 means. I'm not going to get into that. H2 blockers can be used both as needed and as an everyday maintenance treatment. These do take about 30 minutes to an hour to work though, but they last up to 10 hours. Examples of H2 blockers are Pepcid and Zantac. There's also one called Tagamet, but I really advise not taking Tagamet or cimetidine because it has a lot of drug interactions with other medications that the Zantac or the Pepcid don't have. Now remember, use generics, use generics, use generics. How many times do I have to tell you to use a generic? It's usually located right next to the brand. Save money. The last drug class of medications that I want to talk about is the PPI, and the PPIs stand for proton pump inhibitors. That's another complicated situation I don't want to get into right now. Now, if the other two classes of medications don't work, then is when you resort to a PPI. Now, PPIs actually work the best in treating acid reflux. The only reason that I don't recommend these right off the bat is because they have a lot of potential side effects. There are no studies that show that one PPI works better than the other. PPI examples are Prilosec and Nexium. But again, choose the cheapest one. There should be generics available, and there's no studies that show that one of them is going to be more effective than the other. Your body might prefer one PPI over another. If you try one and it doesn't work, don't be afraid to try another one. PPIs are usually taken 30 minutes to an hour before meals. It is often recommended to use a PPI for 8 weeks. Then you should consider weaning off. Now you got to make sure that if you're taking a PPI for a long period of time, you don't just stop it abruptly. If you stop taking a PPI without weaning off, you can have something called rebound reflux, which sucks. Trust me, you do not want to have that. While tapering off a PPI, you can also use an H2 blocker or an antacid for symptoms that break through. Make sure when you're stopping a PPI that you want to taper that drug over a 4 to 6 week period. It's really important to set up a plan to wean off PPIs. After you set up that plan and you've officially stopped the PPI, see if your symptoms come back. Hopefully your symptoms won't return. If not, awesome, you're welcome. If your symptoms do return, it might be time for an appointment with your healthcare provider. You can always reach out to me for a specific plan on how to stop your PPI. Now, the reason I don't recommend PPIs to begin with is people usually get great results while taking an H2 blocker or an antacid. PPIs are linked to a specific stomach infection called C. diff. C. diff is short for a really long infection that I really can't pronounce. So I'm just going to say C. diff. But this infection can cause very severe diarrhea. PPIs are also linked to increased risk of fractures, especially in postmenopausal women. That's right, Mom. I'm talking to you here. PPIs have also been linked to having pneumonia. However, that's more likely for people who are in the hospital. PPIs can deplete your calcium levels, your vitamin B12 levels, and your magnesium levels. It is important to know that you cannot crush or chew any PPI. However, there are some PPIs that do come in granule form where you can open a capsule and sprinkle it over applesauce. Sometimes I do have patients that are taking a PPI, but at nighttime they still get really bad symptoms. If you are taking a PPI every single day and you just have really bad symptoms at nighttime, you can take an H2 blocker at night to help with those symptoms. Now, because these drugs affect the acid levels in your system, it can cause changes in the way that other medications are absorbed. So this is why it's really important to check with your healthcare provider or your pharmacist before you start taking any new medication. Let's recap. Know your triggers. The first options for treating acid reflux is going to be antacids or the H2 blockers. You can use PPIs, but because of all the side effects associated with it, it's really not something we want to use long term. And lastly, always involve your pharmacist. This stuff's complicated and you got other things to worry about. As always, do not start or change the way you take any medications without first talking with your pharmacist or healthcare provider. That's all I have for today. If you have any other questions, please feel free to reach out to me. My email is richard@medvize.com. That's richard@medvize.com. Thanks for watching. Take care. No.